This healing response happens naturally in your body every day. But when you have arthritis, the injury is far too great for your body to heal by itself. And it magnifies and speeds up your body's healing process is what the RIT therapy does, and it makes possible to heal injuries your body can't heal on its own. And it's a well-known fact that the older the person gets, the less efficient their cells are. So why would this apply to cartilage? It does. The older a person gets, the less efficient they are at healing. And what's the determining factor? It's oxygen. So luckily, we've been able to discover how to do regenerative injection therapy using oxidative medicine. And aging is an oxygen deficiency. Injuries are oxygen deficiency. You see, the leading cause of aging is the inability to get the oxygen into your cells. The New England Journal of Medicine concluded that the single biggest difference between a 25-year-old and a 75-year-old is simply that the 25-year-old's body is better able to utilize oxygen. So let's improve that. So how do we do that? Several ways, but the most effective way is to use the ozone therapy. And it's a safe therapy. It's been proven safe and effective in over 3,000 European studies and over 384,000 patients. And here's how it works. You take oxygen, you run it through an electric spark, and you create 3 molecules of oxygen. And ozone is a simple form of oxygen that has 3 atoms. That's all. And as you know, oxygen likes to travel in pairs, and since ozone contains a 3rd oxygen atom, it wants to give it away, and it increases the oxygen in the cells, which means that whenever ozone comes into contact with the cell, it gives up the extra oxygen and the cell takes it in. It produces more energy, and as the cell takes more oxygen, it works more efficiently. And it makes cartilage in the case of joints, and it helps muscle cells in the case of muscles, and it helps tendon cells in the case of tendons in our clinical experience. And that means that you can create more collagen and more cartilage. So now you have this amazing crackerjack construction crew rushing over to your joints and into your muscles and into your tendons and ligaments at lightning speed, and it helps to beat the arthritis battle. Imagine a life free of pain and stiffness. And what kinds of joint pain? Knees, hips, ankles, shoulders, wrists, thumbs, and it doesn't stop there either. It works on the spine for herniated disc, for whiplash, and for chronic low back pain. And by the way, it's not just for joints, it's good for tendons, meniscus tears, rotator cuff, muscle strains, tendon strains, weak ligaments. So to review everything, arthritis, muscle tears, sprains and strains can be treated. You can resume a normal life, and some of the principal characteristics that makes this message so unique are the following. There's really not any contraindications, it has a high success rate, there's virtually 0 recovery time, and there's minimal side effects. It's a non-toxic, non-surgical, non-steroid treatment. Now here's how we do it. We do an examination and evaluation. We consider doing nerve rewiring depending on the patient condition. We go into the procedure room, we do the procedure, we put you in recovery, and afterwards you're not limited in activity, but don't overdo it. Don't go run a marathon or go do a bunch of CrossFit immediately after. You can use ice if you get a little bit of swelling, and again, we want to control inflammation, but the least amount of anti-inflammatories to use that makes the treatments work better. Our assistant will give you a checkout sheet, and now, if you want to improve your outcomes, consider doing the following. There's a German arthritis treatment where we can actually do some oxygen ozone therapy into the blood. We want to avoid inflammatory foods like white sugar, high fructose corn syrup, and even grains, and give the body good nutrition like CMO, which stands for acetylmyristolate, Joint Revive, Joint Review from Nature's Annex, essential fatty acids, and a proteolytic enzyme. And if you have those things and you're covered, great. If you need some specific direction, I'm happy to do that for you, and our team can do that for you. Now, for people that really want to take it up a level, consider doing a whole patient workup. Take a medical microscopy, do a blood test, and tailor a program. And we have seen amazing clinical outcomes with the West Clinic Regenerative Injection Therapy. We're so excited that you're here. On behalf of our team and myself, thank you for coming into the office. We can't wait to help you feel the improvement. I'm Dr. Jason West. Here's to your energy, balance, and longevity.